In this video, we are looking at the topic of brain death, and it's kind of a follow-on from our What is Death video. There are a lot of misconceptions about what this term means, and this can be disastrous for a loved one who is actually in this situation. So we're going to discuss what it is, what it isn't, the misconceptions, and what it means for you. As a side note before we begin, please like, share and subscribe if you find this video informative. It really helps the video get pushed through the YouTube algorithm and suggested to non-subscribers. Your support is very much appreciated. Now let's talk brain death. Brain death is defined as the irreversible cessation of all functions of the entire brain, including the brainstem. Basically, the brain has been so badly damaged that it has completely and permanently stopped functioning. Under Australian law, brain death is one of two situations in which a person can be certified dead. The other is circulatory death, which is when the person's heart stops functioning. Except over here in WA, where we just don't have a legal definition of death, because, I don't know, we're special like that. Brain death can happen after a severe head injury, bleeding on the brain from a stroke or hemorrhage, an infection in the brain, or lack of oxygen to the brain. With that in mind, now we're going to have a bit of medical talk. So, just like any other part of the body, when the brain is injured, it swells. Because the brain is encased in a skull which is rigid, this swelling can result in an increase in pressure. The swelling and pressure might become so severe that the blood flow to the brain is blocked, which causes further damage to the brain. Now, brain cells are very sensitive to lack of blood and oxygen. Without these, the brain cells can die. When this happens, the brain stops performing its vital functions such as controlling breathing, controlling heart rate, keeping blood pressure up, and keeping body temperature up. All things that are necessary for life. And since brain cells cannot grow or recover, brain death is irreversible. Notice how we said, and medical professionals will say, confirmed rather than diagnose? Because you can't diagnose death, you can only confirm it. It is one of the many things that people with a loved one who is brain dead like to overlook. So how is brain death confirmed? Well, two senior doctors must perform separate tests at the bedside to determine whether the brain is working or not. And what they are looking for is to see if the cranial nerve that passes through the brainstem and controls all vital reflexes are working. They check to see if the person has any response to pain, has any response when a light is shone into the pupil of each eye, whether they blink or move when the eye is touched, whether they respond to ice-cold water in the ear canal, whether they have a cough or gag reaction when the back of their throat is touched, and whether they can breathe when disconnected from a ventilator. For a person to be certified brain dead, they must show no response to every one of these tests. Now, in some cases, not all of these tests can be done, such as in the case of extensive facial injuries. In such cases, radiological imaging is done to check if there is any blood flow to the brain, and a confirmation will look something like this. And we'll come back to that scan image a little later. Once doctors have confirmed the brain is indeed dead, the patient's time of death will be recorded as the time when the brain death was confirmed. The first misconception a family will likely have in this situation is that because their loved one's skin can still feel warm and look pink and their chest is moving, then they can't be dead. But this is only happening because they are connected to a ventilator, and the heart will continue to beat as long as it receives oxygen. But without a brain, the body does not secrete important hormones needed to keep biological processes running for longer than a week. This includes the gastric, kidney, and immune functions. Additionally, a dead person's brain can't regulate blood pressure or body temperature. And while doctors can give medication for blood pressure and throw a blanket on for warmth, they can't do anything to keep the hormones pumping through your body that make your thyroid and gastric system work. The second misconception is that brain death and coma or vegetative state are the same thing. They aren't. They are completely different. If we look at these scans, you can see that there is still activity going on in a patient's brain who is in a vegetative state. And a coma would look very similar to that. Their brain cells are still working. Yes, they may be severely demoralized, but they are still working, and that is very clear on these scans. But they are not working in the brain dead patient. The third misconception is that brain death is just a severe brain injury and it will get better if the doctors just give it time to recover. No, brain death is the end of the line. They are not coming back from it. They do not need time to recover because you can't recover from death. You can be instantly brain dead, or you can have a brain injury that leads to brain death. It all depends on how it came about. Did you have a stroke? Were you in a car accident? Were there self-inflicted injuries? You can be young, middle-aged or elderly, it doesn't matter. And this is one of those medical situations that is very difficult for many families to wrap their minds around. And there are many cases of families wanting to believe that their loved one is just in a coma and will recover, and they spend years of their lives and thousands of dollars putting their loved ones in these rehab type medical facilities, believing that medical professionals don't know what they're talking about. Death denial is a very real thing. Now, of course, this reaction is very common when families are initially told, and doctors expect this. It is a natural, immediate response. But most families come to the realization, as painful as it is, that this is the end of the line for their loved one, and they let go and allow the machines to be turned off. Now, I believe as a psychotherapist and as a death educator that everyone should have an advanced care directive. But I strongly believe more so that you need one if your family is the type to not listen to those responsible for your care, like this situation. Write down explicit instructions for what you want should you have a stroke, should your heart stop beating, you're in a coma. Any medical situation where you won't be able to communicate what you want, write down what you would want. It helps families who are indecisive make decisions based on your wishes, and it makes sure that your decisions are carried out should your family, shall we say, be thinking more about themselves than you. We've said it a number of times on this channel, not every family is perfect. So to sum up, brain death is not reversible, death denial is very real in some people, and go write your damn healthcare directives. And with that, give us a like, consider subscribing, and go talk death.